Alrighty, for those of you who are on Zoom in here, we got a minute before class starts. If you want to start getting connected to our poll everywhere here, you can go ahead and do that. There's a QR code. I know those don't always work from like a screen, so you can also go to this web link, or you can text to 37607. So you can do it on text or on your computer or just on the website on your phone. This was like and it showed you when people joined, but it did not. So yeah, go ahead and get yourself joined up here. You can just go to pollev.com/KarenMyers601. And the O is a 0, sorry, should be more specific. Or you can scan this QR code or send a text to that number if you want to answer via text. So folks who are just coming in and just joining us on Zoom, we are going to start with our warm-up today as a poll everywhere. If you haven't done these before, they're pretty fun. We get answers in real time. So you can just join by text or by web following the instructions on the screen. I'll give another minute or so for folks to join, and then we will dive on in. Yeah. Do you have to register, or can we do it without? You should be able to do it without registering. With technology, God only knows. So again, pollev.com/KarenMyers601. I am MYERS, not MEYERS. A lot of people, including my colleagues who email me with my email spelled right, will spell my last name right. And it's just not going to get you where you need to be. So make sure that you are doing that. Again, folks on Zoom, you can also join up by using this website or joining by text, particularly if you are on your computer. You can use your phone or vice versa. Alrighty, and I believe there will be, at the top of every screen, it will give you hang on just a second. I'm just making sure all my questions are in here. They are. Okay. So we're going to kind of go backwards. I don't know why it started this way, but so you can just type in your response to this one. So why are we learning about assessment and a theories of personality class? We're talking about theories. Why are we going to like assess stuff? And again, I was right. The info on how to join is right up at top. And as you all respond, it will anonymously populate it up here. So we've got assessment is one of the easiest ways to get information on personality. Assessments can be used in determining and analyzing theories. Very true. Personality is something you can assess to gain more info on a person. Yeah, especially in, let's say, a clinical setting. It's important to evaluate, someone's personality in order to think about the theories surrounding personality. That makes sense to me. Can allow you to look at different personalities and traits and theories and then to evaluate them. They can show what might be affecting personality. Yeah, that's really important. An assessment is an evaluation of something. So in theories of personality, I think they use an assessment to find out information on people's personalities. Yeah. Because you have to take assessments to start thinking of personalities that could possibly be present. Yeah, that makes sense. In order to apply these theories, we must assess the clients in order to treat them appropriately. This is very important, right? So like, yes, this class is abstract in a lot of ways, right? Because again, it's sort of like a philosophy class, but in the real world, we do want to be able to apply this, right? We want to be able to say, oh yeah, we can actually take these ideas and help someone with it. Assessment is a way to get a baseline. You can use the same assessment for multiple people to see how they differ. Yes. We need to know ways we can learn about personalities. Everyone has one. They can impact actions and thoughts. By using assessments, we can test and gain more information. It's important to be able to analyze and evaluate information and data. It's required to gain information of a person and evaluate them. And there are various assessments used to examine personality and make a diagnosis. These assessments are based on the theories and possibly used to test them. That is such a good point. Yeah, we're going to talk today about assessments that are based solely on one theory. There's so many different types of personality. You have to assess them to identify it, definitely. Excellent answers. Sorry if you're still typing. I'm going to go ahead and go to the next question. So which of these would be your best guess? Which of these types of assessment has the most scientific research behind it? And again, what I love is as you all choose your answer, this will populate on the screen, which is really cool. So a lot of people saying interview or self-report questionnaires. A couple of people saying projectives, it looks like. Yeah, kind of going back and forth. Love that. Love that. Alrighty. And so now we're going to go ahead and look at another question. If you had to guess, which of the following assessments is done every time you see someone in a clinical setting? Again, love this. We're seeing self-report questionnaires, projectives, interviews. A lot of people saying interviews. I know some of you have taken my assessment class, so kind of know the answer to this. That's okay. All right, so this gives you an indication of sort of where we think these things might lie. And this is supposed to be its own question, but it looks like it just gave it its own title. And I think we kind of answered that one when you were talking about why we do assessment, why we're learning about assessment. So we'll do these types of poll everywheres every once in a while. It's just a really fun way to get sort of a baseline of what people are thinking. And as you saw, fairly easy to interact with. And the thing I really like about poll everywheres is that y'all can just be honest because your name isn't associated with it, right? So folks can just feel really comfortable sharing what they have. So yeah, assessment, all the reasons you all talked about. When we're working with individual clients, right, this can be really helpful. Sometimes we're going to use these assessments on a larger scale to do research about personality, which a lot of you were also saying in your answers. Personality assessment is one of my favorite aspects of personality psychology. And what's really funny about that is when I was y'all's age, I would have never said that. I don't think I knew what assessment was. Like, I'm sure we covered it in passing in a couple of my classes. But I was just like vaguely aware of it. And then I got to graduate school and I went to Kent State University. And I did not know when I applied there that Kent State is consistently ranked in the top 3 for research and teaching of assessment in the country. So I learned a lot of assessments. I took 3 courses on assessment my first year, additional courses following year. We did a ton of assessments. Every client who came into our training clinic got several of the assessments we're going to talk about today. I have a lot of experience in this, which again, when I was in your position, I never would have been like, yes, I'm going to be a semi-expert on assessment, right? But here we are. Okay, I just put that in there to remind myself. Okay, so what is assessment? It is a collection or collecting of relevant information in an effort to reach some sort of conclusion. And again, typically about a person sitting in front of you in a clinical setting. And that's that idiographic information we mentioned in passing before. Idiographic, the individual information about a client. So if someone comes to you as a therapist, they want help, you need to do some sort of assessment to figure out what's going on and how to treatment plan. Nomothetic information, again, is going to give us general information, name, general information about maybe a personality disorder or a personality trait. And this would be more in the realm of research, but again, sometimes we'll use these assessments that we're talking about for research. And so it gets a little muddled. Clinical assessment is a lot of what we were talking about in your examples. It's collecting information to determine how and why a person is struggling or needs help, and then how we can help them. In other words, conclusions to be reached here is whether that person has any kind of psychopathology. In this case, we'd be looking at like personality disorders, right? And are they behaving in a way that's different? Are they feeling in a way that's different? And again, using that information to treatment plan. What can be done to help this person? Clinical assessment can also be used throughout therapy to monitor how that person's doing and if they're changing. We hope that they're changing, right? But they might not be. Standardization is so important during clinical assessments in particular. This means setting up common steps to be followed whenever an instrument or test is administered, whoever is administering it, and to whom. So probably the clearest example of standardization are the Wechsler scales. These are intelligence tests. This is an example of someone giving it, and it is ridiculously specific. So this book she has open gives her all the instructions as she tests this guy. There are instructions about where this book should be set relative to the client, how to set these blocks that they're going to make things with doubt, things along those lines. And the idea is I could give the test, one of you could give the test, my friend who works for the Navy in California could give the test, and we should get about the same response from the person. And that's why that standardization is so important. So everyone who takes it should have the same experience of opportunity, provided it's actually administered following the standard procedure. So a couple things we're going to talk about just in passing here are reliability and validity. Reliability is the consistency of measurement. So is it going to be measuring the same thing every time you give it, basically? There's a couple different types of iterator reliability, reliability, period. Iterator reliability is, let's say you're doing a behavioral observation. How consistent are the people who are rating that behavior with each other? So this is so dated now, fully acknowledged, but these are the original American Idol judges. And this guy Randy was always like, yo dog, you're a little pitchy dog. I don't know, dog. Simon was always just like, that was terrible. I can't do an English accent, but that was him. And then Paula Abdul was always like, you look beautiful, and that was lovely. Really poor iterator reliability. They just watched the same performance, gave 3 totally different answers, right? Ideally, you would want them to be very consistent. Retest reliability would be, you take an assessment now, you take it next week. Are your scores similar? Internal consistency is, are all the questions on this assessment related? Are they all measuring the same thing? Right? A silly example I've given for this in the past is like, we're measuring depression and we're like, do you feel sad? Is it hard to do activities? And then the poor internal consistency would be like, do you like ice cream? Is there a puppy? Right? You want all the questions to actually be about your temperature. All right, so validity. assesses the extent to which you're actually measuring what you think you're measuring. And so this is important, right? We want to be consistent. So there are a couple types of validity. One is face validity. Does it look like it's measuring what it's supposed to measure? So most measures of like depression are like this, or extroversion, right? They're pretty obvious. If you have a measure of extroversion, it's like, do you like interacting with people, right? Are you talkative at parties? You don't always need face validity, but some measures have that, and that's cool. Predictive validity is, can it predict what will happen in the future? So if I assess this person and they get this score, will that predict they'll do well in therapy? Will that predict risk of them harming themselves or somebody else? Concurrence validity is the extent to which measures from two different assessments given at the same time on the same day agree with each other. And so the difference between predictive and concurrent validity is predictive looks at 2 time points. Concurrent is going to be 2 measures at the same time point. Content validity is whether you're getting everything you need to have about that construct. So again, if I have a measure of depression, and I'm just asking you about being sad, that's only part of depression. I also need to ask you about whether you've had any changes to your appetite, to your sleeping, whether you've been feeling hopeless, things along those lines. And then construct validity is whether when you make a new questionnaire, a new measure, is it related to previously existing ways of measuring that idea? Or is it like out in left field, right? So always validity is telling us, are we measuring what we want to measure, and are we doing it well, essentially? All right, so several of you mentioned clinical interviews, and yes, for the question about what should you always do in a clinical setting, you always start with an interview. You need to get to know the person, you need to find out what's going on with them, you also need to start establishing rapport, right? A big chunk of how effective therapy is how well the client and the therapist get along. And you got to start that from. There are 2 types of clinical interviews where you'll collect detailed information about the client's life and circumstances. The first and most common is the unstructured interview. You ask open-ended questions to get the person talking. Like whenever I did a clinical interview, my first question was, tell me about what brought you in today. Some people would answer this with 1 sentence. I've just been feeling down. I had a guy I saw with narcissistic personality disorder. He talked for about 45 minutes on this question. So just behaviorally, it could give you a lot of information, right? How they answer these things. Tell me about your previous psychiatric history, your previous medical history. What was it like to grow up in your family? Do you feel like people are there for you when you need them? Also, you get a lot from nonverbal. So not only my narcissistic PD example, but also let's say you're asking that person questions about substance use and they keep avoiding those questions, right? Just the non-answering is enough to be like, okay, next session, I'm going to come back and ask more about this, right? Maybe not push them now, because again, I'm trying to establish rapport, but I'll come back. This is important. You could also have a structured interview. A lot of times these are given in research-based settings or settings where you're not beholden to insurance. I was going to come up with a fancy term for it, but insurance. So if you are taking insurance to see your clients, which most people end up having to do, by the end of your first session with that person, you have to have a diagnosis to write down, even if it's only been 45 minutes, because otherwise the insurance is not going to pay for that initial session. if you're in a training clinic or a research setting, or if you're at some place where we know it's going to be covered, like the VA, you're going to have more time and you can engage with these structured interviews. So when I was in grad school, we gave everybody, we did an unstructured interview with everybody, and then we gave everybody this SCID, which is a structured interview. And the structured interviews in general ask about symptoms. The format of the questions is highly standardized, and you score the people's answers according to criteria. The SCID in particular covers a lot of common diagnoses. So depression and anxiety disorders, things along those lines. And so like the first question on the SCID is, in the past 2 months, have you been feeling depressed or down most of the day, nearly every day? And if you notice, I didn't need to read that because I asked every client I saw at my training clinics that, so that's like bored into my memory, right? And then you probe further about the details. Another example that I learned when I was at the VA on my residency is the clinician administered PTSD scale, or the CAPS. And so this is very specific about the symptoms of PTSD. Have you ever had unwanted memories of the event? What were they like? What did you remember? Frequency. How often have you had those memories in the past month or the past week? And this goes from never to daily or almost daily. You also ask about intensity. How much distress or discomfort did those memories cause you? Were you able to put them out of your mind and think about something else? How hard did you have to try? How much did they interfere with your life? And again, this would go from 0, none, up to 4, extreme incapacitating distress, cannot dismiss memories, unable to continue your typical activities. What would that look like? I had a client who had gotten out of the military, but because where we lived in Augusta, Georgia, didn't necessarily have the best job prospects. He was now working civil service at the same Army base where he had been in the military. And whenever someone brought up Iraq, he left the room. This was in 2009, 2010. Iraq got brought up a lot, right? So this was getting in the way of him doing his job, because you can't leave the room every time someone talks about the main thing you're focusing on right then. And so these give you much more specific information. If you're doing this at, like, let's say the VA, where that person is going to get these services covered for free if they have all the symptoms, you've got to be very specific, right? But you always want to do an unstructured interview too, so that you just gather general info about the person. A mental status exam is something that you might do formally or informally. It's a set of questions and observations that evaluate awareness, orientation to person, place, time, situation, and things like attention, memory, judgment, mood, even their appearance. So most cases that I saw in my training clinic and just in like a common outpatient therapy situation, we were able to do this just by, could they find the place? Did they show up on time? Did they know their own name, right? Did they appear generally like they're put together, right? Or did they look really disheveled? In the cases when I was doing neuropsychological assessment, so I was specifically assessing for things like dementia, along those lines, we would do a formal mental status exam where we ask them things like, what's today's date? What city and state are we in? What building are we in? On what floor? These are the questions where they'll ask, like, who's the president of the United States? Things like that. And we would give them little memory cues. I'm going to tell you 3 words, and then in a little bit, I'm going to ask you for those 3 words again. Things along those lines. The general limitations with interviews are they might lack validity, that accuracy, partially because people sometimes can't or won't report accurately, right? If you have some sort of mental block, this happens a lot with like PTSD. Part of what your brain does when you experience a traumatic event is purposely try to keep the information from you to protect you, right? And there's a whole like process of how that happens. And so they might not be able to access those memories and tell you in detail about their traumatic event. And it's not that they're not trying, right? It's just their brain isn't letting them. They also might have reasons not to fully disclose, right? Let's say they're getting evaluated by you to see if they might be eligible for workers' comp or for a lawsuit, right? Where they're trying to say, people owe me money because of how I was harmed. They might be motivated to misrepresent or lie, right? Because of that. Interviewer bias may unfairly influence how those results are interpreted. I'll give you the silliest example I've ever seen. When I was in my placement, my 4th year of graduate school, I worked in a hospital outpatient setting. We were a psychology clinic. Across the hall was a psychiatry clinic. And so we often shared clients, right? They would see them for med management, we would do the therapy. One of the psychiatrists did not believe unipolar depression existed. He did not believe that major depressive disorder was a disorder. He thought every single person who presented with depression was bipolar and they just hadn't had a manic episode yet. This is not scientifically correct, right? Depression on its own exists, but so every client he sent me would be diagnosed with bipolar disorder. And then I do the assessment, I'm like, just depression, man, right? And so that can be tricky. Another thing, like less silly example is, because my area of research and my clinical training really focus on eating disorders, I would be much more likely to probe clients about their eating. And so let's say I'm seeing a PTSD client, they don't have an eating disorder, but I might ask them how their eating is being affected, right? Where someone else wouldn't bother. Oh, you're binging when you're really stressed out. Okay, that's also something we can address if you want to, right? Someone else just might not ask about that. And third, these might lack reliability simply because people will respond differently to different interviewers. There's a lot of research that people are much more likely to open up if they can relate to the interviewer, if they feel like the interviewer is like them in some way. So, if you are a person of color and you go to see a therapist of color, you might be much more forthcoming. The problem is, unfortunately, we don't have very many therapists of color, right? We're trying to build up diversity, but we don't have it in our field. Or just sometimes your personalities don't mesh, right? And that doesn't, and that's fine, but it also means you might not get accurate things. Give you one more example. So when I was in grad school in our training clinic, we were all under the same web of confidentiality. That meant we could talk to each other about our cases, and then we kept it confidential within ourselves, right? We didn't go like blab it on the street at Chipotle, but we could talk to each other so we could learn from each other's cases. And so one day there was a client who came in and told our assistant clinic director, I really need to see a male therapist. He was male. And so she assigned him to a male therapist for the intake. He went away, it was Tracy, the assistant clinic director, and I were in the clinic, and we were like, what was that about? Why did he need a male therapist? Well, the guy's problem was an impulse control disorder where he was masturbating 6 hours a day. He did not feel comfortable opening up to a female therapist who was around his age, right? We were all like 22 to 27 about that. So that might affect, like if he had a female therapist, he might have never been forthcoming about that. That becomes really important. And this is also why, this is like a side note, not actually related to theories of personality, but just like life lessons. If you all are ever seeking therapy or assessment and you feel like you don't mesh with the person, you are not beholden to them. You can shop around just like you would for any other professional, right? If you went to a salon or a barber shop and they kept effing up your hair, right, you wouldn't go back. Same thing with a therapist. You can be like, nah, this isn't for me. It doesn't have to be like that evil, right? You just be like, no, I'm gonna try somebody else. That's okay. some of you have heard the story, I've ghosted a therapist before. She like was not helpful. I left her office, I just never called her. That's probably not very professional, but I was just like, went back to an old therapist, she was great. All right, now we're gonna start talking about clinical tests. This is what we'll talk about for the rest of the next 2 days. There are lots of different subcategories, as you can see. The ones, actually, psychologists do all of these except for neuroimaging. Neuroimaging is typically done actually by a tech, to be perfectly honest, someone who's trained to give it. It's often interpreted by experts in imaging or maybe by a neurologist. Typically, unless they're trained to do it for research purposes, psychologists are not like in the room when neuroimaging is happening. We're going to start with projectives. Show you all, I wore my Rorschach dress today to go along with it. I actually remembered for once. I always forget. And I'm like, oh, I should have worn it. So projective tests, you know, we were thinking as we were going through your responses about, you know, why do we talk about assessment? Projective tests are a really clear example of a type of assessment that's tied to a particular theory. So these are tied very clearly to psychoanalytic and psychodynamic theory. In these tests, participants or subjects, I just had this conversation with my intro class, these terms were used interchangeably, subject or participant. Typically, most psychologists like participant in this day and age, just because it implies voluntary participation in the study, right? But you'll see both terms used. But in this case, I have subjects up here, but they are going to interpret some sort of vague stimuli or follow open-ended directions. And theoretically, the idea is that because it's so vague, participants will project their personality or aspects of their personality into their answers, into the tasks. And again, this is used by psychodynamic or psychoanalytic clinicians to try to assess unconscious drives and conflicts. Really interestingly, when I was going to apply for my clinical internship, my residency, I had to be trained in this because at that time, around 2008, 2009, there were still a lot of non-psychoanalytic schools that required you to know how to be able to do this. Like if I wanted to apply to like hospitals in Boston, I needed to be able to do this. It was very bizarre. I don't know if this is still the case. So I am trained in the Rorschach. We took like a 3-day class on it. And it was like, day, like 9 to 5. It was a lot of psychoanalytic stuff. And I've given it twice. So I'm not that much of an expert, but I can at least impart some of my experiences. One important thing to note about the Rorschach and projectives in general is that the validity of projected tests has been called into question because they're so subjective. And in some cases, some of these assessments we'll talk about can essentially be interpreted and rated almost however the assessor chooses. It's not very scientific, right? And so to combat this, people who do like projectives and think they're helpful have created standardized scoring for the projectives. Some people argue that's not enough, we shouldn't give them still, but other people argue like this at least helps a little bit, right? All right, so this is the Rorschach. This is the most famous one. You've probably seen this in movies, right? There's like one old film where the computer's like, they're like, what do you see? And he's like, blood for everyone. So this is a like fake Rorschach plot to give you the vibe, but as I pointed out, I'm wearing a dress with the Rorschach ink blots on it. This is an actual Rorschach ink blot on it. Technically and ethically, I'm not supposed to be showing you the actual ink blots. Let me show you why. I don't really care anymore. It makes me sad, but If we go to Wikipedia and we scroll all the way down to the bottom, here are all 10 plots. I had to pay $70 when I first got here to get a copy, and I'll bring it on Friday. Not the school paid it, not me. But these have each of the cards. It has common answers. This is basically like a cheat sheet for the Rorschach on Wikipedia. And when this was first posted, people tried to get it taken down, and I guess like copyright wise, they somehow got permission where it's never been taken down. And so if you want to see all 10 Rorschach cards, you can. And yeah, it's interesting, right? So that's why I don't mind showing you, you know, 1 or 2 of them here. So this is my old cat Finley, passed away about 6 years ago, but I had her in grad school, and one of the times, actually I think both times I gave the Rorschach, I had to take it to my placement site, which was across town. And so I had to like check them out of our clinic, and I had them at home, and I decided to just like stick it up and be like, what will my cat do? I thought she'd ignore it. She stared at it for a while. It was interesting. But what you do is you show these, and then you say, what might this be? And then you roll from there. So again, there are 10 of these. We'll go over on Friday a little bit more about how you administer it. I'll just tell you, for like my personal experience giving it, I did get more information I didn't get from some of the standard types of assessments that we'll talk about either today or Wednesday. That being said, and granted, this is largely because I was new at giving it, right? Having only ever given 2. It doesn't take very long to administer, maybe about a half hour, but it took me 6 hours to score and interpret it each time I gave it. Whereas some of these other questionnaires might take 5 minutes, half hour, right? So it's like, I don't know if the amount of extra information it gave me justified those extra person hours, right? And that's something to kind of think about. I was trained in a standardized scoring system called the Exner system. And so this is like as close as we get to being really scientific with a projective. All right, another type of projective is the thematic apperception test, or TAT. And this involves people being shown 30 black and white cards which show ambiguous situations. Now, interestingly, I realize in my notes I say it involves showing them 30 cards. There are 30 cards. You only show them a subset, and like you kind of choose which subset you show. Again, if we're talking standardized procedure, this is not great, right? But the idea is each one that you show the person you're talking to, whether they're a client or a research participant, are asked to make up a story about what's going on in the picture. So who they identify with, the emotions they express, and themes that come up over and over are all part of the interpretation, but there's no standard scoring procedure. So again, it's all interpretation. This one's a really nice one to use as an example of how diverse these things can be. So just throw out some answers. I don't know how to interpret the TAT, so I'm not judging you. But what do we think could be happening in this picture? Yeah.
The guy that is like sick and his partner is sad.
Yeah. So maybe he's sick. What else could be happening?
She killed him.
Oh, I love that one. Yeah, maybe she killed him. And she's like, oh no, I shouldn't have killed him.
I thought he looked wrong. Like,
Oh yeah, he could have like rolled in from the close height, right? Yeah, so she's mad at him. Yeah, maybe he's dead. Another one I get a lot is maybe he cheated on her and she just found out, right? And so all those different things you look at over time, over the however many images you give them, and see what comes up over and over and over again. Again, I never actually gave this clinically. I did have a therapy professor in undergrad who had given this and told us a story. There's one that's just like a bench by a lake with like a couple sitting there. And this guy apparently was like, well, they're watching the guy drown, that they just tied like cement blocks to his feet. And it's like, okay then, right? Like there's nothing in that picture to indicate that. So it can be revealing. It's just, is that level of revelation actually helpful? I don't know. There are people who swear by it. Sentence completion is the one I have given the most often. So sentence completion is you give them a bunch of these stems. The one that I often gave is like a page front and back of these. And then you ask them to finish a sentence from the start of the sentence that's there. So I wish, again, it's Freudian, so we got to have a my mother in there, right? And then again, you look for themes. So there are versions of sentence completion that do have scoring that you look at. There are also a version where it's just open to interpretation. The reason I've given this a lot is we were required to do X amount of what they called comprehensive assessments when I was in graduate school. And in order to be comprehensive, it had to include a projective. This one's pretty fast to give. So a lot of us would just give this. I do remember at least one case where this was really eye-opening. It was someone who'd been referred to me for a neuropsychological assessment. She was a really interesting story, actually. She had electroconvulsive therapy, which is used in really severe cases of like psychosis or depression. And a rare but a side effect that happens is that you can have memory loss with it. And she genuinely did it. But one of the things that came up on her sentence completion was she wrote a lot about food and eating. And again, I'm me, that's what I'm trained in, and so my little ears went, and she had been referred by one of my friends who was her therapist within the same clinic. And so I mentioned this to her therapist when I gave the formal report, but also just sort of consultation. And this ended up being something they worked on together in therapy that the client probably would have never brought up independently, but was something that was really bothering her. Because I think a lot of people are like, oh, my therapist doesn't want to talk to me about my food. And some of us are like, yes, we do. We will help. All right, so the next thing we're going to start talking about is personality inventories. These are what I have given the most commonly. We gave one of these to every single client who came into our training clinic. I also gave these at the VA as well, so I have a lot of experience giving these. And in fact, you'll see a few slides from now that a couple of my professors in graduate school, like they do serious research on this. So these are designed to measure more broad personality characteristics. They focus on things like behaviors, beliefs, and feelings. And they're usually self-reported. So the person either fills out bubbles maybe, or answers numbers, or circles something, or more and more they're being done on the computer now, where the person will sit and fill them out. The really interesting thing with that is that some of this is now adapted, where they will, like the answers, the number of questions you get will change based on how you answer things. So that like someone might not have to go through all 300 plus questions if they're not endorsing certain things. Makes it shorter for the people taking it. It's important to note that only standardized psychology personality tests should be used in clinical practice or in research. A personality from a magazine or BuzzFeed, right, is fun, but not actually accurate. This is sort of a send-up of that. This is a, what color are you? Choose your favorite color. This guy's red. You are red. There have been various variations of this over the years. When I was in undergrad, there was a website called Tickle.com that had a lot of these types of services. At some point, they moved to Facebook. My favorite one I've ever taken was Are You a Hamster? But it was spelled wrong. So it was like, Are you a hamster? I was not a hamster, shockingly. But I was like, man, let's look at bad questionnaires. The things you do when you're a psychologist. So these are used really commonly because they give us a lot of information from one instrument. So the one I know the most about is the Minnesota Multiphasic Personality Inventory, or the MMPI. So this is, the original was 567 self-statements. This has been drastically cut over the years. But I do have to say, like, even when it was this many statements, it would take someone like yourselves, because most of the people we saw in our training clinic were college students, 45 minutes to an hour to fill it out, because it's all true false. So it's pretty quick to respond to. Is this true of me? Is this false of me? Or maybe I can't say. Or they leave it blank. Some examples of items are, I would rather win than lose in a game. I have never been happier than when I am alone. My hardest battles are with myself. And so there are various types of scales, and again, these have adapted over the years as well. But essentially, there are these clinical scales that assess symptoms of disorders like depression, but also personality traits like introversion. There are a whole bunch of subscales based on that, that have evolved over time and become more scientific and give you a lot of really interesting information. Now, one side note here is that depending on where you go, what you look at, whose book you look at, you will see that scores on the MMPI are interpreted if they're 70 or above, or if they're 65 or above. Well, actually, on the most recent MMPI, it kind of depends on the scale, but in general, it's 65 and above. So fun little tidbit about psychology is it can be as political as any other field. So I was taught by Jack Graham, who wrote a whole book of interpretation for the MMPI 2. So his book was the book we used. He used the 65 cutoff. It was great. It was helpful. Everything made sense. While I was on my residency at the VA, we had Jim Green come in and give a MMPI workshop. He used the 70 cutoff. He had some different interpretations. I sat next to him at the lunch we had after the workshop, and I said, "Oh, so nice to meet you. I'm from Kent State. I trained under John Graham." He turned away from me and did not talk to me the rest of the lunch. There's like MMPI beef, apparently. I was like, well, that didn't go how I expected it to. I thought that would like connect us. It's silly, it's stupid. People have turf wars, right? A lot of like some fields are not like them. And the other really interesting thing is on the MMPI 3, the most recent version, in fact, when you order the test, it comes with its own interpretation book. So it doesn't matter what other people say now, there's a standardized interpretation guide. It's just interesting. The other thing that's really important is there are validity scales. These are embedded within the instrument. The participant or client doesn't even know they're taking them. But these assess essentially how much they're paying attention to the test, how much they're engaging with it, and whether they're answering honestly. So these are really important, particularly let's say you are assessing someone who, again, maybe they're trying to have a lawsuit saying I was damaged by this happening to me. There are scales that indicate that that person might be lying or exaggerating. Opposite end of it. Let's say you've got someone in a child custody battle you're assessing. Very typical to give both parents a full assessment, including the MMPI. You're probably going to like what we call fake good or try to make themselves look better than they are. Like there are questions like, I read the whole newspaper from cover to cover every day. Like no one does that. No one reads like every single want ad, right? And so what's really interesting is like, not only does that scale already exist, but because the people who are trying to get child custody are really trying to present themselves well, there's a different cutoff that you have to use when you have a child custody case. To see that they are like actually lying as opposed to just trying to make them both look good. It's also an indication that if that person doesn't try to do that, maybe they don't want the kits, or maybe they just lack insight to be able to know that they should be trying to make themselves really good, right? And so this is a great questionnaire that we'll get into much more on Wednesday. Alrighty, thanks everybody, and thanks everyone who was able to sign on Zoom today. Everyone have a great day.